Kenya has joined the rest of the world in marking the World Cancer Day at Kasarani Primary School and at various events in the counties. The commemoration comes on the heels of the National Cancer Summit that painted a grim picture of the cancer burden in Kenya, with data from the National Cancer Registry showing that 2 out of every 3 people diagnosed with cancer succumb to the disease. We are now joined live by our reporter Mary Mwoki, who is at the Kasarani Primary School. Mwoki, good afternoon. Maybe you can paint a picture of what's happening there and who's in attendance.
Yeah, he wants to make a round appearance. Yes, so he's doing his round and he's
Orandi, it's a very good afternoon to you. As you've mentioned, we're here at Kasarani Primary School, where Kenya is joining the rest of the world in commemorating World Cancer Day. And the theme for this year is Closing the Gap, and it has been a rallying call over and over again. Of course, this is coming on the heels of the 2-day National Cancer Summit that winded up yesterday, and some of the statistics coming from that cancer summit was just something else. With having numbers like 2 out of every 3 people diagnosed with cancer dying or succumbing to the disease. And we also have 70% of cancer patients being diagnosed a bit late. And speaker after speaker today, and everyone who spoke at the function today, is rallying the government to go beyond just the free screening and actually have an affirmative budget for cancer treatment. Something else also that has come through, or something else that the government has been asked to do and to give priorities to ensuring that the county governments are also empowered, to have cancer treatment facilities, to just reduce the inequality that is there when it comes to accessing healthcare for people in rural areas, bearing in mind that most cancer treatment centers are in urban areas. It's also sad, coming at a time when the country, or rather a 2021 World Bank report said that 1 million Kenyans have fallen beyond the poverty line due to health-related expenditures, and a time also when the country is, going through an economic crisis. And we had the health CS speaking at the National Cancer Summit saying that the government going forward is going to do more to ensure that cancer screening, treatment, and all the care that is required for cancer patients is easily accessible even to those at the bottom of the barrel. And there's also been calls to empower the National Health Insurance Fund to cater for cancer treatment, which is not the case for many at the moment. We've also had testimonials from cancer patients, just describing how difficult it has been for them to get appointments for chemotherapy or radiotherapy for those that require it. So that's what is coming up at this time. Orandi, we will keep on the story and we will update you in our subsequent bulletins. Wycliffe.